My name is YongJoo Rhee. I'm a associate professor at the Dongdok Women's University at Department of Health Science. I mainly teach actually public health subject and during the semester, and then I do the research during the winter and summer break.
Okay, and how would you explain what you do to a lay person and the type of research or policy work that you do?
I'm very interested in actually helping older adults in communities, so I try to develop the really better health policy related to any type of research associated with older Koreans. Particularly, I just wanted to let them live their lives in community and they get all the helps and then until their health, actually death, and then they can actually live longer and then die at home. That's what I want to do. Also, I'm very interested in mental health issue, which is sometimes dementia, depression, some severe mental issue. Basically, all the patients with a mental health issue, they cannot stay in the hospital for long, and they have to discharge at some point, and then they have to live in communities. So there must be some support system for them. So I just would like to actually develop that kind of community mental system too.
Okay, and what would you say are currently the three main policy priorities for long-term care in South Korea?
South Korea has been really struggling with the long-term care issue for the past 10 years. That's why we actually launched long-term care insurance in 2008, and it was a really quick and really fast policy change. But they didn't put too much into thought to how to carry on all the services, finances, and quality of care. So that's been really big issue. And then government noticed that the long-term care, particularly in nursing home, costs a lot of money. So they wanted to actually switch the actual policy to develop the community care, which is a really big buzzing word in Korea, because new administration of Moon, he actually used this agenda when he was elected, and then now try to help the really new model to provide care for the older Koreans in community, integrated social services, and medical care services in community. That's one new thing. And then, yeah, in terms of these community care, definitely we are facing a big issue to integrate medical care and social services, because our system mainly developed by medical health institutes, which is actually hospital-based all the services. So if you have some problem, we can go into any clinics with all the national health insurance cover. But if you don't feel like we don't know what they are problem, you do not have any primary care physician for that. So we are just always kind of paying for all the healthcare services throughout the hospital. So which is really cost a lot of money, and it's not going to work for all the folks. So now we are trying to do some new innovative model to build up whole together. That's the second issue. And then I also mentioned about the poor quality of services in nursing home. It has been really a stigma, also really big issue in this field. So if you have older parents or family, if they have to send it to the nursing home, it's the last thing to do, seriously. And a lot of older folks, they think they're going to just die there when they are admitted to a nursing home, because of their poor quality. There are a lot of abusive events happening, and then there were also some big fire, some kind of accident in nursing home, and we couldn't save any of these residents because they were actually tied in bed. It was a huge issue a couple of years ago, because the nursing home administrator, they just don't want to take care of them, carefully. So they actually tied to the bed, and then they couldn't save that when they had a fire. So all poor quality, and then the stigma, that's another big issue too.
Okay, and how do you think, to what extent these priorities have changed in the last 5 years, if they have changed at all?
Well, actually, I already mentioned that community care is a huge change, and that it's really kind of killing issue right now because since our Korean health system has been developed by all the hospital-based sort of a system, now they have to shift to the some of part to the community care to integrate all different part of the services, but which we never have tried that, and each part actually function like each silos. For example, finance sources and then professionals, all that they never actually had that experience to work all together. And then how they actually they don't know how to actually refer to the patient or all the Koreans to the certain places when they need something. So now they try to do whole things together. So now they try to put up everything focus in communities. So that's a huge change. Yeah.
Okay. And if you had an opportunity to introduce one new long-term care policy in South Korea, what would that be and why?
Well, I'm a big fan of the community-based whole services or something like that one. And then I just wanted to keep the older folks, they have their authority and their own right to choose their own services. Just demanded or told by a certain professional. So I just wanted to see how integrated this medical part and social care for the actually older Koreans. So I just wanted to see how we can change the actually certain regulation and then develop the new professionals. Particularly care coordinator. Yeah, we don't have that kind of professional yet. I heard that the UK or some European country, they have a really excellent job to do that kind of a function. So we are trying to do that, but it's not the easy job because when you try to make a new professional and you have to deal with a existing, medical professional, which is a really huge interest group. So it's a really struggle, and there's a battle. It's an everyday battle at this point. So I just wanted to actually contribute that part to navigate it to this whole chaotic issue to make this work for all the folks who need actually good care and then their lives until their death at home. So that's what I want to do. Yeah.
Okay, and in terms of research priorities, what do you think is an outstanding piece of research in long-term care that needs to be carried out in South Korea?
Well, we need to know how to integrate medical and social care services whole together like a UK. And I think that's the key fundamental issue at this point to develop the community care system in Korea. So I think that's being said, that's why they actually use the term and then try to put that in the system in short time period. So last year they already passed a law, and then central government actually set a huge budget for them, and then tried to develop the model, but they don't know how to do it. So the local government, such as Seoul City, they actually try to do some kind of pilot project to send it out actually nurses to the some community at home, which actually they can find the older folks who need care. So that kind of new trial actually very, very innovative, and then sometimes it's contradictory and then cause a lot of problem, but it's moving fast. So I think it's a really exciting moment to see all the changes. I think that's the probably outstanding point of the Korea now. Yeah.
Okay, and now I'm going to ask you a few very quick questions, and I'm looking for a number of responses from 1 to 10, where 1 is low and 10 is high. So, first of all, what would you say is policy priority allocated to long-term care in South Korea?
9.
9.
Yeah. Okay. Everybody's aware of that, and then every single daily news mentioned that issue too, so it's almost 9.
Okay, how aware do you think is the general public in South Korea about what the long-term care system can offer to them?
Well, I would say 9 because you even kind of common lay people are aware of our long-term care due system. They know they already pay for the long-term care insurance throughout the national insurance, and that they know what they can get services, but they are not happy about the service quality, but they are all aware of that. Yeah.
Okay, and how well do you think the system supports people with long-term care needs?
Well, I would say 5 because first the volume wise is not actually sufficient enough for the people who need. When they actually get all the applicants, almost 60% of the only applicants get the approval to get any type of long-term care in nursing home or home care. So it's still high in demand, and then quality-wise, it's still so low, and particularly in nursing home, that institute, we don't have actually medical professional staying in nursing home, which is actually registered nurse or nurse aide. So there are a lot of issues to prescribe the wrong medication, to take care of them, and then that's why some of Korean families, they actually admit their older parents in hospital, not in the nursing home, for that reason. Yeah, so it's really bad. Yeah.
Okay, and my last question, how integrated are social care and healthcare services in South Korea?
Two. Well, I have to be honest. When I meet the social worker folks, they have their own agenda, and they have their own interest and their own stake. And the medical part, I mean the physician and nurses, and in between somewhere, some people, they just don't want them, their sort of authority to somebody else. So they are kind of really kind of arguing, and they cannot come to a common ground. So it's still really work in progress. So I think the government should do some take action, like a legislation or some kind of policy sort of protocol. Other than that, it's not gonna be work. So, but we try to work. So, yeah.
Okay, well, that was my last question. Thank you very much for your time.
Thank you.